Well, the surgery to my lungs has taken a good bit of lung tissue out. On my left lung, I probably have 40% of that lung left. On the right lung, I have maybe 80% of that lung left. Thoracotomy surgeries are very, very difficult, and they're painful, but they're also short-term in terms of the treatment of cancer. You know, you recover from the surgery, you recover from the pain. You don't always recover from cancer. I don't feel short of breath when I'm just doing routine things. If I'm hiking in the mountains, I do. After this last surgery, after my 4th thoracotomy, when I got out of the hospital, I stayed home 2 weeks and then I went back to Colorado and still was able to get up to 14,000 feet after my 4th lung surgery. I was short of breath climbing uphill, but I did it. For me, clinical trials was a very positive experience. They watch you so close. Everything is monitored. Some of your medications is even paid for through the clinical trial, through the company that's putting it on. And I just really felt like you get better care. You get a nurse practitioner who monitors everything and is there for every little call that you can make. I was very surprised at the number of doctors who advised me not to go on a clinical trial. They said that, you know, they'll make a guinea pig out of you, or don't let them try to do this to you, or whatever. But for me, standard of care wasn't very promising. Chemotherapy in lung cancer only works in 6% of the population. So I figured what the drugs they already had approved weren't very effective. I might as well try some that hadn't been approved yet, and thought my results would be better. What I have come up with is that you have to surround cancer with 3 different things. One of them is the medical community and what medicine can actually do for you. The doctors and surgery and chemotherapy, radiation, whatever they can throw at me, I want to be able to do. And I want to use them to the full extent, and if I need to get second opinions, if I need to go somewhere else for treatment, if I need to advocate for my own treatment, then I will. You have to also see what yourself can do, what you can do for yourself. And that includes eating right and getting adequate rest and getting exercise and actually taking care of yourself. You have to build your strength up and you have to increase your own immunities. But the third thing is your faith in God and power of prayer. And that has to equally be a part of your treatment. And you know, there's no statistic on what the power of prayer can do. There's no way to describe what a faith in God will do for your spirit to keep you fighting. I'm Lori Monroe, and I am a 3-year stage 4 lung cancer survivor.